About a year ago, the governor created the Mental Health and Wellness Commission in order to address the needs and to improve the quality of life and opportunities for self-determination of people with mental illnesses and developmental disabilities and substance use disorders. And the work of the commission, or the scope of the commission, is very, very broad. It goes beyond just how do we deliver services to people and what services do we deliver to people, but also how do our general government services like education and law enforcement work for people that have different neurological makeups. And so as we try to establish the roadmap for the future and how we better accommodate success and independence for these folks, the commission itself was formed in order to develop that roadmap or that long-term strategic plan. Every single citizen in our state has something to contribute to society. Every single person has value that they can add to their community. And if we provide the right type of support, particularly early in life, but also as somebody moves from childhood and into adulthood and hopefully independence, that they really can be a positive and important part of Michigan's future. Stigma among people with mental illnesses, that's a big problem that we have to really focus in with specific initiatives. And the reason it is a problem is because sometimes people are embarrassed to even seek the type of help that they need in order to achieve the best results, the best outcomes for their life. If we're committed to finding to finding solutions to stigma, starting early in life, hopefully, but then also supporting efforts in workplaces and giving opportunity to people that otherwise haven't seen it, I think you'll see independence improve. You'll see people that will start taking chances and steps toward a more full, self-determined life. Integrating the behavioral health and the physical health systems and access to care in our state will make a really big difference in the quality of life that are in the outcomes of our healthcare system in the first place. I mean, ultimately what we're trying to achieve here is a healthcare system that recognizes that the brain is part of the body, and what's happening with the brain is affecting the rest of the body, and what's happening with the rest of the body is affecting the brain. And when we put these things together, when we remove the obstacles to providing a healthcare system that is truly integrated in this fashion, we'll make big progress in the overall quality of life of our citizens. When you have a child that is maybe in special education in a school system, but also receiving clinical care outside of the school, and is maybe in a foster care home, or somebody that's helped by certain programs in the Department of Community Health, there's so many different possibilities here. We need to make sure that everybody's on the same page, that the expectations, that the tools in the toolkit, that they're all working together in the best interest of our children. And this is an area where we have so much promise and so much opportunity, so much hope for the future. When you address problems and you do it right in the beginning, it really will pay dividends long into the future when it comes to reliance on the government, but more important than that, the quality of life of that individual and their family. The state of Michigan itself provides some services to people to veterans, but so much of what we do is in partnership with the federal government. It's going to be a really heavy lift, but it is incumbent upon us to make sure that whether it's things that are done by the federal government or things done by the state, that for our population here in Michigan, that we have to get it right, and we have to make sure that we have expectations that the promises that the federal government made to our soldiers and the responsibilities that we have are met in the most effective way possible. So much they've given so much, and they have so much to offer. Over the course of the next year, we will be in implementation phase. So we have put together the report with very specific action items that we can take in order to make the whole system work better for our citizens. It's going to require, in some cases, resource considerations, and we'll need to make some changes in statute in order to accommodate this. But in a lot of cases, We need a concerted effort by all of these different agencies and private sector partners to work together for the best possible outcome, and that means coordinated care. That means knowing what each other are doing and making sure that we're reinforcing and supporting the quality of life of the individual, but also their independence and their ability to self-determine where they want to take their life. If we make all of this happen, if we go through and we follow this roadmap, we will improve the lives of thousands and thousands of families across Michigan, and our whole state will be better for it.